Good morning, Lake Providence Church family and friends. This is Dr. Linda Plummer Ward, and greetings. Thank you for joining us today for this health ministry update. So the metrics for Nashville and Davidson County have not changed much in the last few weeks. We are waiting and praying that the metrics continue to remain stable even after spring break. The FDA gave the Johnson & Johnson or the J&J vaccine emergency use authorization in the last week. Now, this vaccine is different in a number of ways. It's not a messenger RNA vaccine like Pfizer and Moderna. It's made from the shell of a strain of the adenovirus that can no longer infect or replicate. And that information to make the spike protein from SARS-CoV-2, which is the virus that causes COVID-19, it's placed inside that adenovirus shell so that it can enter the cell. The adenovirus shell provides the vehicle for that message to enter our cells. Once inside the cells, the process is very much like the messenger RNA vaccines. The cell gets the information to make the spike protein. Our cells see the spike protein and then mounts an immune response. The immune response tells some of our cells to attack, others to destroy, others to remember that foreign spike protein. So the next time we are exposed to the spike protein, those memory cells see it and they remember it. An immune response is started again to protect us before the virus has a chance to replicate and take over our bodies. Now, this is not the same as boosting the immune system, which we try to do with natural products like vitamin C, vitamin D, and zinc. There's no harm in attempting to boost the immune system now, but understand that the vaccine's function is different. It's not to boost the immune system. It's designed to prevent severe COVID-19 and death. The vaccine actually introduces our body to a piece of the COVID-19 spike protein without us having to get infected. It teaches our cells to make antibodies against it, and this is how our bodies will know to protect us from severe COVID-19 if and when we are exposed. The vaccine may not keep you from getting a mild form of COVID-19. That's true. The intent of the vaccine is to prevent severe disease, hospitalizations, and deaths. The vaccines cannot give you COVID-19 because they don't contain the virus itself. And the virus itself must be present in order to replicate in our cells and make us sick and spread to others. That's how viruses take over our bodies and our communities. Pfizer and Moderna were tested first, but they were tested when any symptoms were experienced in vaccinated patients during the clinical trials, and they showed 94 to 95% efficacy. In the U.S., J&J showed 66 to 72% efficacy in preventing severe disease and death. Now, J&J is one shot. Its efficacy improves over time. It does not require sub-zero refrigeration. It takes a little longer to produce, but is easier to store. It was tested in South Africa. That's where the South African variant makes up over 90% of the strains there. J&J was 100% effective against severe disease, hospitalization, and death in the face of the South African variant. Its side effects are sore arm, mild fever, muscle aches, headaches, and nothing at all. Similar to Pfizer and Moderna, it varies from person to person. So which vaccine is best? The COVID vaccine that's available to you when you are eligible, that's the one that you should get. And why do we need to get it so soon? Why now? Because the more of us that are vaccinated now, the sooner we reach herd immunity and get back to some form of normalcy. The less opportunity the virus has to infect us, replicate in us, using us as host, and then mutate, forming variants that our vaccines may not work against in the future. So I hope this was helpful. And let me leave you with a brief announcement. Lake Providence Church and the Matthew Walker Comprehensive Care Clinic will partner to give the J&J vaccine shots on Saturday, March 27th. That's next weekend, from 9 a.m. to 1 p.m. in the church. More information to come. So watch the LPMBC website, the LPMBC Nashville Facebook page, and the LPMBC Nashville Health Facebook page for more information in the next few days. As always, we pray that you stay safe, stay healthy, and stay prayed up.